Hello, everyone, and welcome to another episode of the Heart Next Door podcast. As you know, this season we are providing a safe space to talk all about maternal health and family wellness. And today's guest is truly a history maker. It's such an honor to have him. He is not only a phenomenal individual, but also a great mentor that I really admire and look up to a lot. So I'm just so thankful today to have Dr. Zazove. Welcome. How are you?
Good. Thank you for having me.
Good.
It's a pleasure being here.
Yes, it is a pleasure and an honor. And so for those of people listening who may not know anything about you, can you tell everyone who is Dr. Philip Zazove?
So I am many things. But I was born in Chicago in the last millennium.
Yeah.
And interestingly, when I was born, I was a very sickly baby. My parents had to spend 2 weeks waking me up or shaking me every time I stopped breathing.
Wow.
Then I became fine until I was 4. And they found out I was deaf. Interesting, my father was putting books on bookshelves, and they said, "Dad, you have to look at me to understand me." He said, "Huh?" And then one thing led to another, and they found out I was deaf. And at that time, the prevailing wisdom was that if you're deaf, you go to a deaf school. If you're lucky, you become a custodian. And I was just lucky because I was poor before they found out, and I was doing okay and keeping up. So my parents basically decided I was going to become a first. I was the first deaf kid mainstream in public schools.
Wow.
And so I ended up like everybody else. That's how I ended up doing the rest of my story being here.
Yeah. Wow. It's truly phenomenal. And just talk about the power of parents advocating for their kids. And
Enormous. I wouldn't be here if I wasn't for them.
Mhm. And I think that's really beautiful because my background is in education. And so I remember as a teacher, there's kind of a sentiment almost whenever there is a kid and maybe they're so quick to like box them, like to say, oh, you should be in this class, or oh, you have this label, you have this, disability and whatnot. But I think it really makes a difference when parents and, the adults in our children's life advocate for us. And so I love that your parents, that your mom especially, did that for you. And I know that it's largely shaped the work that you do. So talking about like taking you from that standpoint of being the first deaf child to go through, education, mainstream education, what was it then like in your adulthood? Like, how did that shape your career? There's some other great achievements that you've had. Can you tell us more about like your early career and the work that you do as well?
I think God gave me choice. Like I feel like I was the prevailing wisdom. I was destined to become lucky to have a job.
Yeah.
In those days, the deaf schools were separate but equal. They weren't equal, they were separate. And that's why, and just by going through public school, my parents made sure that I had the opportunity.
Yeah.
And every single year, they told me the principal and the teacher in the next grade, even though I had done very well, if I'm going to fourth to fifth grade, would say, "No, we can't do this. We can't do this. It's not going to work." And every year, my parents advocated and said, "I can't do this."
Wow.
And eventually, I got to college, went to Northwestern, played a little football there, but mainly wanted to go out and decided I wanted to become a doctor.
Yeah.
Actually, my first goal was to become a baseball player.
Really?
I was a good athlete, but not good enough. So I applied to, I think, the first year 20 medical school.
Wow.
Didn't get in. A friend of a friend found out that one of the schools was because I'm deaf.
Mm.
So the next year I applied to 36. medical school, and I got him one. And ended up being the third deaf doctor in
Wow.
America. Now there's about 300 of us. Best done that was come to know.
The third
Mm-hmm.
doctor in America. Wow. And what did that feel like for you?
I'm actually, I didn't know. I mean, it felt like me.
Yeah.
You know?
Yeah.
But even I learned from my parents how to advocate. Like you said, my parents advocated for me, and then I had to advocate for myself. Either way.
Mhm.
I feel like I've opened the door. That's probably the thing that make me feel most good.
Yeah.
For all these 300 other people who come in.
Yeah, that is beautiful. And speaking of just like opening the door, moving the way for other generations, another huge part of the work that you do is with, the foundation to honor your mom. Can you talk a little bit more about the foundation as well?
Sure. It's named after my mom, the Louise Tumarkin Zazove Foundation. It started, she died in 94, and time near death. And people gave money. I'm not sure why, they just gave money for something.
Yeah.
And the family got together and decided my mom grew up poor, very poor. They were kicked out of their apartment many times. So she succeeded because she was a doctor, the first woman, talking about first, she's the only woman in her class.
Wow.
In my school, but she succeeded because she had education in New York. You have 3 colleges. Just the City College of New York back then was free.
Really?
She'd work on the day, go at night. So education is definitely a deaf sin. So we thought, let's provide college scholarship for deaf students to their interest.
Yeah.
And so we started in 2003.
And since then, so you started the foundation in 2003 to honor your mom, providing, making sure that other kids are able to follow in the same footsteps that you did. And so since then, how many kids have you helped?
I think it's 55 students now. And we get 4,500 per student per year right now for 4 years, assuming they continue.
Yeah.
And we get this year we have for a new grantee, and we have 320 applications. So huge need.
Definitely.
We can do poor better than nothing, but we have a way to go.
Yeah. Wow, that is truly phenomenal. And I think that's just such a beautiful way to honor your mom's legacy and to help pave the way for others like you. And I know another huge part of the work that you do and have done is also with maternal health as well. I know that you were the chair of the department at the University of Michigan.
Family medicine.
Family medicine, yes, sir. And I know also that you are the president of the board of the Lou Clinic as well, which is truly phenomenal. And so because this platform is largely related to maternal health, as you know about my personal story too, I love how you shared the piece about advocating. Your parents advocated for you. And so when you think about your experience as a physician and, with the expertise that you have, what would you say are some of the most urgent challenges that parents and moms are facing today?
Depends on your social strata, too. I think people who are underserved have a lot more challenges.
Yeah.
I can think of 3 offhand. Number 1 is misinformation. Perfect example is vaccination. There's so much data, probably more data about the safety of vaccines than almost anything else we have, just because of the millions and millions of kids who've gotten them.
Yeah.
They're so effective and they're so safe. Yeah. There's so much misinformation about the thing. The second is health insurance.
Yes.
Obamacare subsidies out disappear.
Yeah.
The cost of insurance overall for everybody has gone up dramatically. What do you do if you don't have health insurance? How do you get health care for yourself, to your kid?
Yeah.
And the third is resources. If you live in a small town or in a city, no more hospitals.
Mm-hmm.
You know, either the hospitals are going out of business or they're not doing maternal care because you guys can make money.
Yeah.
And I think those are major problems in getting good healthcare and good outcomes.
Yeah, for sure, for sure. Those are all very relatable and very true, issues that you've raised and that you've shared. And I think a lot of times we hear the perspective of, moms, especially on this platform. But you are also a dad, yes, and you are also a, physician who had a mom that really advocated for you. And so knowing all of the problems that we have, the issues that you raised in maternal health, what message or advice would you give for parents trying to advocate for, themselves and their families, especially in today's world?
I think we're lucky today compared to when my mom and dad had me.
Yeah.
We have so much more information available on the internet.
Mhm.
The issue is making sure you get your information from good sources.
Yeah.
If you're thinking about healthcare, your family doc, particularly if they are part of a group, and they have to be a university, it can be a private group.
Yeah.
Because groups tend to monitor their own. If somebody is not performing at a certain level, they would do something about it.
Mm-hmm.
There are many superb private doctors.
Mm-hmm.
In general, the group, I think, monitor their own.
Yeah.
And getting your information on the internet from trusted sources, from a university webpage or a national health insurance page, and not getting those someplace.
Yeah. Yeah.
And unfortunately, many people, they go on the internet, the first thing they see is something that's not true, and they believe it.
Yeah.
And last, anybody can do anything. I'm living proof of it.
Yes, for
and
sure.
so your kids can do what they want to do. I don't care what kind of disability they have, what kind of failure they have.
Yeah.
It takes a lot of work, but you can get there.
Yeah, for sure. You definitely are for sure living proof of that. And I think that's a beautiful message. And I think your story is just so inspiring to help people realize that you don't have to, accept the limits that other people try to place on you, that you can always advocate for yourself and you can always, decide. You can always decide. You always have a choice. And so I think that's a really powerful just in itself. And I would love to hear, especially as a physician, retired physician now, how has your lived experience or how did your lived experience shape the way that you as a physician approach patient care?
That's an interesting question. So the main issue for somebody who's deaf is communicating with the rest of the world. After the three main issues, communication with the world, communication with the it really is. And every deaf person will tell you. I think that has made me a much better listener when I'm with the patient because I realize how important communication is.
Yeah.
And listening to people and patients in groups and working with them there. And I think that's probably the number one. It's interesting the number of deaf staff who have come after me. A disproportionate number of them have gone into family medicine and primary care because that's part of what we do. You're listening and help people. It's not just surgery. I'm not putting down what they do.
Yeah.
It's a different bargain. And the second thing, I like to think, I thought.
No. You want? Yeah, I think you touched on some really, really great points just about like the listening, right? I think that that's just such a powerful tool in general, not just for navigating the medical space, but in navigating life and period. I think that so much more understanding could be had amongst all of us if we just listen more to each other.
I really think people don't listen very well.
Oh, for sure. Right, yeah.
they cut people off.
Yeah.
They want to have their
Yes. Yes.
and
Yes.
people often have better ideas than you.
Yes, exactly.
I can't emphasize that enough.
Yeah. And I think that it's powerful when you don't just listen to, respond, but you listen to actually just hear what the person is saying. And so I think that is a huge lesson that we can take from that. And so just thinking about your journey as a physician and now as a dad, I'm also curious too, when, you have kids as well. And so when you and your wife were, navigating, like when you were a patient, let's say, like when your wife was having your kids, what was that experience like for you? And would you say that because you were a physician, were you better able to like advocate or just what was that experience like? I'm curious. How was it? Because I know it says that I've heard a saying that says that doctors make the worst patients. So what was that like for you?
I think you have to trust your doctor at some point, and I think you understand what's going on better.
Yeah.
That doesn't mean that you make the decision. You just have to trust your doctor. Having a kid is an amazing experience.
Yeah.
From as a dad, it's just amazing.
Yeah.
And the whole pregnancy, the labor, the delivery, holding the baby. It's just like, wow.
Yeah. It is beautiful. Yeah. And so thinking about, that being a dad, just like looking at your life, all the amazing, extraordinary things that you have accomplished, making history, and with the foundation, the work that you do. If your mom, was able to, as she looks down, like what do you think that she would say, imagining everything that you've accomplished?
Similar. I think she'd be very proud.
Yeah.
She may not admit it. But I think she'd be very proud because of what we're doing for other people. And her son, who was told he couldn't be anything, they got to done what I've done. And I think she should be proud of me. And remember, she grew up in a very disadvantaged situation in the city of New York. And she knows what people can do and just give people an opportunity. But some of these families don't have money or the ground them for every dollar to pay for food, and that is just going to make a difference.
For sure, definitely. I imagine that, and I know that in general, like today we live in, it's just a very interesting time, to be living, but I think that the message is the same. Carries a lot of us forward, like we're meant here to help each other, and I love the way that you were able to take your experience and then like reach back and help to lift other people up as well. And I think that that's what it's all about. And a lesson that I often ask people when they come on the podcast is, what does legacy mean to you? And so I would like to hear from you, Dr. Zazove. What does that mean? What is your legacy? We know your mom's legacy and what that is. It's you, but what do you hope that your legacy will be?
I think I mentioned it earlier that I opened the door for other people who are deaf or have significant hearing loss. They can do what they want to do if they want to go into medicine. And I like to think, maybe I'm biased, that it rubbed off on other fields besides medicine too, engineering, law, you name it. I'm seeing a lot more people do that.
Yeah, that's beautiful. So, the sky is the limit, right? Essentially. And so I think that's beautiful, and just so thankful for you, thankful for, just who you are as not just as a physician or, a foundation executive, but also just as a human. I'm very thankful for you. And you have been such a great advisor and mentor for me. And I just want to let you know how much I appreciate you. And I appreciate you coming on this platform.
The feeling is mutual.
Yes. And so can you tell everyone how they can get involved and learn more about, especially your work with your mom's foundation, the Louise Tumarkin Zazove Foundation?
I would love to have more people involved. We have so many areas people can help with, ranging from donating to holding a fundraiser from a financial perspective. We need help with social media, with Facebook, Instagram, or whatever your favorite social media is. We have people help with reviewing applications in the year and helping us narrow those down. There's so many other ways. So just contact me or go on the website and look up the Louise Tumarkin Zazove Foundation, and you see a contact icon. Click on that and fill that out, and we'll get back to you. Thank you.
Thank you. Well, there you have it, everyone. Thank you so much for listening and watching. We'll see you next time on The Heart Next Door. Bye.
Thank you.